everyone. I'm Penny Wilson, Director of Healthcare Services for MCHD. Thank you so much for being here today. We're here today to launch a new program that will help Montgomery County residents save money on their family's prescriptions. It's called the Coast to Coast RX Prescription Discount Card Program. With us today are David Hernandez and Brandy Schroeder. Y'all wave to everybody. From MCHD, and Zach Barrett from Financial Marketing Concepts, the company that is providing the discount card to the county. This card is a good example of the hospital district working on new initiatives to help residents. Some of the highlights of the free prescription discount card that the card now provides is savings of up to 75% on brand name and generic prescription drugs. The card is free. There are no fees to get a card, and it can cover your entire family. The card can be picked up at almost every Montgomery County pharmacy, at area libraries, health facilities, and many county buildings. We do have them here in our own administration buildings. The card can also be printed by visiting www.coasttocoastrx.com. The card works for most prescriptions also if you fill those at a pharmacy. The card does not expire, can be used as many times as needed. There's no health, age, or income restrictions. Everybody qualifies to use the card. The information that is gathered at the pharmacy when you use the card is confidential. It's not used for any other purpose than to just help you get a discount. The program comes at no cost to the hospital district, and it actually will generate some revenue to help us fund our needed services. So it's a win-win for the hospital district and our taxpayers. I'd like to introduce Zach Barrett, representing Financial Marketing Concepts, to tell you all a little bit more about the card and answer any questions you may have. Zach?
Zach Barrett, I'm the representative of Financial Marketing Concepts, but we endorse the Coast to Coast RX card here from Montgomery County Hospital District. We've been working with county governments, city entities for about 7 years, and we are pleased to be working with Montgomery County Hospital District. This is a large county, over 400,000 people who can take access to our card, save a lot of money. For some people, it can be hundreds of dollars to even thousands of dollars of savings per month or even perhaps a year. And we believe that Montgomery County has the potential to be a really good county for our program and in turn for the hospital district. And our card is good, like Penny said, at any major chain pharmacy for the most part. I spent all last week visiting all the pharmacies, many private physician offices, the Montgomery County library system, and I'm going to spend some little more time today as well. And then going forward, this is not just a one-time distribution of putting cards out in doctors' offices and the libraries and the pharmacies. This will go on forever as long as we're working with the hospital district. Have any questions? Feel free to ask me.
Can you in detail explain how this works, where it's a win-win, where the consumer benefits from the prescriptions and the other aspect?
Okay.
Yeah.
So it benefits the consumer, the end user, by being able to simply go to the pharmacy and get a discount on your prescription. You know, for those who don't have health insurance or prescription coverage, or you have a prescription that's not going to be covered by your health provider, or you have a high deductible, especially those who are in the donut hole of Medicare, you're able to, instead of having to go up to Walgreens or CVS or Kroger, wherever you want to go, you don't have to pay that full 100% price for the prescription. You'll pay at a discount. Those prices, those discounts do range. It can be very low or it can be very high. From what our statistics show, the average savings is anywhere between 50 to 60% off, and it should be the same here in Montgomery County as well. So that's the benefit for the individual. Obviously, the benefit for the hospital district is that in the county overall is that you're helping their citizens. You're going above and beyond. You're helping them save a little bit more money. There's a lot of uninsured citizens in Montgomery County and beyond who can take advantage of this program at no cost other than the discount that they pay at the pharmacy. And in return, our company gives back MCHD $1.25 per paid prescription. which this county has the potential to really be a lot of utilization, and they'll use those royalties to help reduce costs that they would have to normally rely on the taxpayers. So that's the win-win situation. Does that answer your question?
Dollar-wise, over a period of a year, what do you figure countywide on something like this? Where do you put your numbers at as far as what it's going to save people?
We believe, well, let me give you a great comparison. This county is around the size of Collin County, who we've been using now for about a year and a half. Plano, Allen, McKinney, that's those cities in Collin County. They have, in the course of a year and a half, monthly, about an average of $200,000 a month in savings throughout the county. And that county has about 300,000 to 400,000 people as well. So Montgomery County can probably have similar statistics or results. And the demographics up there are about the same as it is here as well.
Savings for the county or the inmate?
For the savings, that 200,000 would be about the savings per month for the overall users of the county, of the card. If you added up all the statistics of the people using their prescription card, it would probably average about 200,000 a month. But that estimate can be like a roller coaster. It can be up and down just depending on the utilization of the card. Any other?
Return to the hospital just dollar-wise.
Again, I would use the Collin County as a comparison. I would say once it gets going after a while, I would think that Montgomery County could probably hit somewhere about, you asking for the royalty, what would that be? Anywhere from about 4,000 to 6,000 a month. Any other questions? It all just depends. Job can be challenging, is just to get people to use the card. You got to put it in as many places as possible. You got to hit into all angles. You just don't go for one specific area. Try to go for everywhere. And so that's why we try to hit all the physicians' offices, like family physicians, pediatrics, internal medicine, where you have a lot of uninsured private pay patients. So, anything else?
Is it just human care, or
Is it just human care?
I know there's a couple of counties running prescription drugs right now that actually have veterinarians on.
Yes, we can use our card. You can use the card for veterinary services as well. So if you have a dog or a cat that has a prescription from your vet and that vet clinic does not have the medicine there on hand, possibly you can take that prescription to Walgreens or CVS or wherever you want to go. And most of those major chain pharmacies carry pet medicine as well. Yes, sir. And I haven't mentioned also, you can use the card also for dental services, vision, imaging, and lab tests, hearing services. So a lot of the people who don't have health insurance to go see their family doctor probably don't have health insurance or don't have dental insurance as well. And the discounts range anywhere 10 to 60% off.
Now, how many dentists are accepting that here in Montgomery County?
I don't have that answer, but what you can do, how do you know? You can't just go to any dentist and use the card. If you go to our website at coasttocoastrx.com or you call our 1-800 number, if you talk to the rep, they will ask you what city you live in or your zip code and a radius of how far you're willing to travel. So 5-10 miles. They'll give you a list of providers within this area.
Quite a few providers already set up in this area?
Yes, sir, there is. There's an organization called Dentamax. It's a nationwide organization where a lot of dentists pay to be part of this group. And with those dues, monthly dues, that's where it's able to allow uninsured patients to come in to get a teeth cleaning or even things as major as a root canal.
Spell your first and last name, please.
Zach, Z-A-C-H, and it's Barrett, B-A-R-R-E-T-T.